Between almost every pair of vertebrae in your spine sits a structure that most people think of as a cushion, a shock absorber, something soft that gets herniated when you lift wrong and replaced when it finally gives out. That description is accurate in the same way that calling your liver a filter is accurate, technically correct, mechanically incomplete. And the incompleteness matters because the part nobody describes is the part that explains why sitting destroys spinal health in a way that no amount of standing desks or lumbar supports can fully prevent. An intervertebral disc has two distinct components doing entirely different jobs. The outer layer, the annulus fibrosus, is a ring of dense collagen fibers arranged in alternating diagonal layers, like a bias-cut fabric, each layer running at roughly 30 degrees to the disc's horizontal plane, alternating direction with every successive layer. This architecture is not accidental. It is engineered to resist torsional loads, the twisting forces that spinal motion constantly produces, while simultaneously constraining the inner material from bulging outward. The inner layer, the nucleus pulposus, is a gel, approximately 80% water in a young adult, held in a pressurized state by the surrounding annular fibers and by the cartilage end plates above and below. That pressurized gel is the actual load-bearing mechanism. When compressive force arrives from body weight or muscular contraction, the nucleus distributes that force in all directions simultaneously, pressing outward against the annular fibers with equal pressure across the full circumference of the disc. The annulus resists this outward pressure, and the combination of pressurized nucleus and tensioned annulus converts a direct compressive load into a distributed tensile load that the collagen fibers are far better designed to handle than a direct crush would produce. This hydraulic mechanism works beautifully under two conditions. The nucleus must be adequately hydrated to maintain its pressure, and the compressive load must arrive while the spine is close to its neutral curve, distributing force evenly across the full disc surface. Sitting violates both conditions simultaneously. Every hour. That is the mechanism this video is built around. Stuart McGill at the University of Waterloo has spent 3 decades studying spinal biomechanics with more precision than almost anyone alive. His laboratory has measured disc pressures in vivo, mapped annular failure patterns under controlled loading, and established the specific positions and loading sequences that protect and that damage spinal tissue. His framework, built from hundreds of peer-reviewed publications, shows consistently that the disc is not a passive cushion. It is an active hydraulic system that depends on 2 variables, fluid content and spinal position. Lose either one, and the load distribution that keeps the annular fibers intact starts to fail. If you're enjoying the story so far, don't forget to hit the like button and subscribe. Drop a comment telling me where in the world you're watching from. I love hearing from you. The nucleus pulposus gets its fluid from the cartilage end plates, the thin layers of hyaline cartilage that cap each vertebral body above and below. These end plates are permeable. Fluid moves through them in both directions depending on the pressure differential across the disc. When compressive load is removed, such as during sleep or when you are upright and moving, the pressure differential draws fluid from the surrounding vertebral bone marrow into the disc, rehydrating the nucleus. When compressive load is sustained, the pressure drives fluid out of the disc and back into the surrounding tissue. You lose approximately 1.5 to 2 millimeters of disc height across the lumbar spine over a full day of upright activity, measurable on MRI, recovering overnight during sleep. This daily fluid cycle is the disc's primary nutritional mechanism. The nucleus pulposus, like articular cartilage, has no direct blood supply in adults. It feeds by imbibition, the rhythmic loading and unloading that pumps fluid and dissolved nutrients in and out. A disc that spends its entire day under sustained compressive load, with no movement to drive the pump, is a disc that is slowly starving. Sitting produces sustained lumbar flexion. When the lumbar spine flexes forward from its natural lordotic curve into flattened or reverse curve position most people adopt in a chair, the vertebral bodies tilt forward relative to each other, opening the posterior disc space and closing the anterior. The nucleus, being a fluid under pressure, migrates posteriorly toward the opening, toward the back of the disc. This is not a catastrophic event in a single session. Over months and years of prolonged daily sitting, the posterior annular fibers experience repeated asymmetric loading from a nucleus pressing against them from the inside, in the same posterior direction day after day. Nachemson measured interdiscal pressures directly in the 1960s and 1970s, inserting needle pressure transducers into lumbar discs of conscious subjects in different positions. His data has been replicated and refined since, but the core finding is unchanged. The intradiscal pressure in relaxed sitting is higher than in standing. The increase is approximately 40% in the lumbar disc compared to upright standing. Leaning forward in a chair raises pressure further. Adding a load in the forward-leaning position raises it further still. The sitting position is not a rest position for the lumbar spine. It is a sustained loading position that removes a pump mechanism, shifts the nucleus posteriorly, and loads the posterior annular fibers at above standing pressure levels continuously for however long the person remains seated. An office worker sitting 8 hours daily is giving the posterior annular fibers of their lumbar discs approximately 2,920 hours per year of asymmetric pressurization in the direction where the spinal cord and nerve roots sit directly behind the disc. The annular fibers, arranged in alternating diagonal layers, are designed to resist this. They are not designed to resist it without interruption across years in a dehydrated disc that the pump mechanism has not adequately refilled. Annular failure follows a predictable sequence. The innermost fibers of the annulus rupture first, allowing the nucleus to migrate further outward. The next layer fails. Then the next. The sequence can progress over years with no pain at all. Because the innermost annular layers have minimal nerve supply, pain arrives when the migration reaches the outer annular layers, which are richly innervated, or when nuclear material escapes through a full-thickness annular tear and contacts the posterior longitudinal ligament or nerve root. That contact is what people call a herniated disc. The event that brought the person a physician is the endpoint of a process that began at a desk years earlier. The facet joints are paired synovial joints connecting each vertebra to the ones above and below at the posterior arch. They are true joints, cartilage surfaces, a synovial cavity, a joint capsule, and like all synovial joints, they require movement to stay healthy. Synovial fluid is produced by the joint capsule and circulates through the cartilage surface under compression and release. Static loading without movement reduces the circulation. In the sitting position, the facet joints of the lumbar spine are partially open as the lumbar curve flattens. The joint surfaces move apart slightly. The joint capsule, which normally provides proprioceptive feedback about spinal position through densely packed mechanoreceptors, is stretched into a position of sustained low-level tension for the duration of the sitting period. Mechanoreceptors in the facet joint capsules contribute to the feed-forward activation of the deep spinal stabilizers, the multifidus and transverse abdominis, that we covered in a previous video. When these mechanoreceptors are held in a sustained stretch position, their firing rate initially increases and then adapts downward through a process called mechanoreceptor accommodation. The proprioceptive signal from the joint capsule weakens over time with sustained static loading. This accommodation is the reason that people who have been sitting for 2 hours feel less stable when they stand up than they did when they first stood up in the morning. The joint capsule has been discharging its proprioceptive signal for 2 hours without a change in stimulus, and the stabilizer system that depends on that signal has reduced its tonic activation in response. When sustained sitting is followed by a sudden demand on the spine, standing abruptly, reaching for something, the stabilizer system that should pre-activate to protect the segment fires with reduced amplitude and delayed timing. The protective mechanism is in a lower state of readiness than it was this morning, precisely when the transition from sitting to moving is the moment that most acute lumbar injuries occur. The facet joints at the thoracic spine behave differently. Thoracic facet joints are oriented to permit rotation and limit flexion and extension in prolonged sitting. As the thoracic spine increases its kyphotic curve to compensate for the loss of lumbar lordosis, the thoracic facets are compressed asymmetrically, and the rib attachments at each thoracic vertebra, the costovertebral joints, are held in a fixed restricted position. Respiratory excursion diminishes. The diaphragm cannot descend fully. Accessory breathing muscles in the neck and upper chest take over, which contributes to the chronic cervical muscle tension that is nearly universal in seated knowledge workers. The spine is not a lumbar problem with thoracic and cervical bystanders. It is a continuous mechanical system where a position problem in one region propagates up and down the chain. Sitting does something to the posterior chain that takes years to become obvious and a surprisingly short time to produce. The gluteus maximus, the primary hip extensor, is in a shortened position when you sit. The muscle does not contract. It sits passively, and the neural signal telling it to contract, the drive from the motor cortex through the corticospinal tract to the alpha motor neurons supplying the gluteal fibers, weakens progressively over hours of non-use. Vladimir Janda, a Czech physiatrist working in the latter half of the 20th century, described the systematic pattern of muscle imbalance that develops in sedentary populations with a specificity that has held up across decades of clinical validation. He called it the lower cross syndrome. Hip flexors become tight and overactive from sustained shortening in sitting. Gluteal muscles become weak and inhibited from sustained lengthened non-use. The deep lumbar extensors tighten to compensate for gluteal weakness. The lower abdominal stabilizers become inhibited in a mirror pattern to the lumbar extensor tightening. The pattern crosses tight hip flexors above and tight lumbar extensors below, with weak glutes above and weak lower abdominals below. The crossing is the observable pattern when you map which muscles are overactive and which are inhibited across the lumbopelvic region. Janda's clinical observation was that tight muscles tend to inhibit their antagonists through reciprocal inhibition, the neurological mechanism that relaxes an opposing muscle when its antagonist contracts. Chronically overactive hip flexors chronically inhibit the glutes through this mechanism, which means that even when a person stands up and theoretically has the opportunity to use their glutes, the neural drive to those muscles is suppressed by the ongoing activity of their antagonists. This is the mechanism behind the phenomenon that every physical therapist recognizes clinically. Patients who are told to squeeze their glutes and cannot produce a meaningful contraction despite adequate muscle bulk. The muscle is there. The neural inhibition suppressing it is also there, and the inhibition wins. The hamstrings, the posterior thigh muscles that flex the knee and assist in hip extension, show a parallel pattern. In sitting, the hamstrings are shortened at the hip and lengthened at the knee simultaneously, a position that loads them at neither end of their functional range. Their contribution to hip extension, one of their primary functional roles in gait and load bearing, is progressively underused as gluteal inhibition forces the lumbar extensors and hamstrings into compensatory patterns they were not designed to sustain. The erector spinae, the long surface muscles running alongside the spine, take on increasing load as the deep segmental stabilizers reduce their tonic activity. They are the wrong tool for segmental control, as the multifidus chapter established. They are the muscle system the lumbar spine defaults to when the local stabilizer system is underdriven. The result is a spine that substitutes global muscle bracing for local segmental control, which is less efficient, more fatiguing, and provides less precise protection of individual spinal segments under unexpected loading. If you're hooked on this story, make sure to subscribe and turn on notifications so you never miss an upload. Your support means everything and helps me bring you more emotional stories like this one. The standard prescription for sitting-related back pain is strengthening, core work, planks, crunches, deadlifts, weighted extensions. And the evidence for these interventions is genuinely mixed, which is puzzling if you accept the premise that a weak core is a problem. The premise is partially wrong. The lumbar spine of a person with sitting-related back pain is not primarily weak. It is mechanically loaded in the wrong position for too long, dehydrated at the disc level, proprioceptively impaired at the facet joint level, and neurally inhibited at the stabilizer level. Applying more compressive load to the spine through weighted exercises introduces more of the stress that the already compromised tissues are struggling to manage. McGill's laboratory has published disc pressure data for common rehabilitation exercises. Crunches, which are prescribed to strengthen the anterior core, produce intradiscal pressure in the lumbar spine that is higher than standing with a moderate load. They also produce significant posterior disc migration of the nucleus, for the same mechanical reason as sitting. Lumbar flexion under load shifts the nucleus posteriorly. A crunch exercise on a person whose posterior annular fibers are already asymmetrically loaded from 8 hours of daily sitting is applying more load to the most compromised part of the disc. This is not an argument that all flexion exercise is wrong for all people. It is an argument that applying compressive flexion loads to a spine whose posterior annular fibers are already under sustained pressure and whose hydration state is compromised by hours of sitting is adding to the problem rather than correcting it. The deeper issue is that most back exercises are applied to the wrong tissue. They target contractile muscle. They work the things you can see and feel working. The disc, the facet joint cartilage, the annular fibers. These are not exercised by contraction. They are restored by movement that drives the fluid pump, restores joint glide across the full available range, and reestablishes the proprioceptive input that the facet mechanoreceptors provide to the stabilizer system. Restoration requires oscillation through range, not compressive loading, not sustained bracing. Rhythmic movement that takes the spine from one end of its motion arc to the other repeatedly with minimal added load. That description matches exactly one exercise that most people have seen demonstrated, and few people actually understand the mechanism behind. The cat-camel is performed on hands and knees. From this quadruped position, the spine is unloaded from axial compression. The full weight of the torso is distributed across the hands and knees rather than compressed down through the lumbar discs in standing or sitting. The lumbar discs in the cat-camel starting position are under approximately 25 to 30% of compressive load they bear in standing and a fraction of what they bear in sitting. From this unloaded position, the movement takes the spine through its full available arc of flexion and extension. In the cat phase, the spine rounds completely, lumbar, thoracic, and cervical regions all flexing toward maximum range, the back arching upward. In the camel phase, the movement reverses completely. The lumbar lordosis is restored and then extended beyond neutral. The thoracic spine flattens, the neck extends. The specific mechanics at each spinal layer during this oscillation. At the disc level, the full-range oscillation drives the nucleus pulposus through the interior of the disc in both directions. Flexion moves the nucleus posteriorly. Extension moves it anteriorly. The alternating motion prevents sustained asymmetric pressurization in either direction. The oscillation also drives the fluid pump mechanism that sustained sitting suppresses. As the disc moves through flexion and extension, the changing pressure gradients across the cartilage end plates draw fluid in and push fluid out in a rhythmic cycle. The disc hydration that hourly sitting progressively reduces is restored by this oscillatory pumping. McGill measured disc hydration changes after the cat-camel directly and documented it in his textbook Low Back Disorders. 10 repetitions of the full oscillation produced measurable improvements in disc height, indicating fluid reuptake into the disc nucleus in subjects who have been seated for a prolonged period. The exercise is specifically described in his clinical framework as a mobility restoration tool rather than a strengthening tool, and the distinction is central to understanding why it works when progressive resistance exercises do not address the same problem. At the facet joint level, the full-range oscillation takes the joint surfaces through their complete glide range. In flexion, the inferior facets of the upper vertebra slide upward and forward on the superior facets of the vertebra below, stretching the posterior capsule. In extension, the movement reverses, compressing the posterior facule and stretching the anterior capsule elements. The mechanoreceptors in the joint capsule receive a continuously changing input signal rather than a sustained static signal of prolonged sitting. Their firing rate increases. The proprioceptive output to the deep stabilizer system is restored. This is the mechanism behind the clinical observation that people with sitting-related back stiffness feel immediate improvement in spinal mobility and a reduction in local stiffness after performing the cat-camel. The facet joints are not merely rotating through range. Their capsular mechanoreceptors are resetting from the accommodated, low-output state that sustained sitting produces. At the muscular level, the cat-camel is not primarily a strengthening exercise and should not be performed as one. McGill's explicit instruction is to move through the range with minimal muscular effort, to allow the spine to hang in each extreme rather than forcibly contracting into it. The purpose is to lubricate the joints and restore the fluid distribution in the discs. Muscular contraction during a movement increases intradiscal pressure and reduces the effectiveness of the pumping mechanism. The multifidus does activate during the cat-camel, but in a different pattern than during loaded exercises. Because the spine is unloaded from axial compression, the multifidus must provide only positional control, not load-bearing support. This is closer to the tonic, low-level activation pattern that the multifidus is designed for the high-force demands of weighted exercises. For a multifidus that has been neurally inhibited by prolonged sitting, the low-demand positional activation during the cat-camel may be a more appropriate reactivation stimulus than a high-demand loaded activation of deadlifts or extensions. At the posterior chain level, the camel phase of the movement requires the gluteus maximus to extend the hip to bring the pelvis into anterior tilt. This is not a maximal contraction. It is a gentle, unloaded hip extension through a full range of motion that the muscle has not been working in for hours of sitting. The neural drive to the glutes is reestablished through the movement pattern rather than through direct conscious contraction, which is mechanically appropriate because the feed-forward system that activates the glutes in functional movement is a movement-based system, not a contraction-based one. The thoracic spine, which is the region most consistently neglected in back exercise programs that focus on the lumbar spine, is fully mobilized during the cat-camel. The thoracic kyphosis that develops in prolonged sitting is reversed during the camel phase as the thoracic extensors engage to bring the mid-back toward extension. The costovertebral joints that become restricted in sitting move through their available range. Respiratory excursion improves in the session following cat-camel practice because the rib attachments that were restricted have received their movement stimulus. The cat-camel is performed before any other back exercise, not after. McGill sequencing places at the start of any spine rehabilitation or maintenance protocol because the disc hydration and joint lubrication it produces prepares the spine for subsequent demands. Performing loaded exercises on a dehydrated, proprioceptively impaired spine, and then doing the cat-camel afterward misses the preparation function entirely. The starting position is hands and knees, wrists under shoulders, knees under hips. The spine begins in neutral position, neither fully flexed nor fully extended. From neutral, the cat phase takes the spine slowly into maximum flexion. Slowly means 3 to 4 seconds through the full range, not a rapid rounding. The full position is held for 2 seconds. Then the camel phase takes the spine slowly into maximum extension, the same 3 to 4 seconds, held for 2 seconds. One full cycle is approximately 10 to 12 seconds. McGill's prescription for the cat-camel as a morning or pre-activity movement is 6 to 8 repetitions. This is not an arbitrary number. It corresponds to the number of cycles needed to drive meaningful fluid redistribution in the disc and restore facet joint mechanoreceptor output from its overnight compressed or sitting compressed state. More repetitions beyond 10 in a single session produce diminishing returns on the fluid mechanics and begin to add fatigue to structures that are best prepared for the day's demands. The exercise is most important at 3 specific times. First, in the morning before any loading of the spine, whether that means before standing from bed or before any back exercise. The spine wakes up having been unloaded during sleep, with discs that have rehydrated overnight, but facet joints that have been in a sustained position for 7 to 8 hours. The cat-camel restores joint mobility and distributes the overnight fluid gained to the disc before compressive loads begin. Second, after any period of prolonged sitting exceeding 45 to 60 minutes. The dehydration and posterior nuclear migration that accumulate during sustained sitting need to be interrupted by the oscillatory pump mechanism before they compound further. This means leaving the chair, getting to a floor surface, and performing 6 to 8 repetitions before returning to work. The entire interruption takes under 3 minutes. Third, before any physical demand on the spine, lifting, exercise, prolonged standing that will impose compressive loads above normal daily activity levels. A disc that has been dehydrated during a morning of sitting and then loaded heavily in the afternoon is a disc whose annular fibers are facing compressive stress with reduced internal pressure to distribute it. The hydraulic protection is diminished precisely when the mechanical demand is highest. The timeline for observable changes follows a layered sequence. Within the first session, most people report immediate reduction in lumbar stiffness after 6 to 8 repetitions. This is a facet joint mechanoreceptor signal being restored from its accommodated state and the beginning of fluid redistribution in the superficial disc layers. The stiffness reduction is real, but short-lived after a single session. The joints have been mobilized. They have not been retrained. After 1 to 2 weeks of daily practice, the morning stiffness that previously required 20 to 30 minutes to resolve begins resolving in under 10 minutes. The facet joints are accumulating a signal history of full range motion that reduces the degree to which they accommodate overnight. The disc fluid cycle is being driven more consistently, so the morning hydration state is being better utilized before compression begins. After 4 to 6 weeks of consistent daily practice, combined with sitting interruptions every 45 to 60 minutes, the disc height loss that MRI studies document across a working day becomes smaller. The fluid pump is working. The posterior nuclear migration that prolonged sitting produces is being periodically reversed before it accumulates to the degree that asymmetrically loads the annular fibers. After 8 to 12 weeks, the changes reach the stabilizer system. The multifidus and transverse abdominis, which the cat-camel activates in its low-demand positional control pattern, have received enough consistent low-level activation that their resting tone increases slightly. The feed-forward timing that was delayed and diminished by prolonged sitting begins to restore, though not to the full extent that specific stabilizer retraining would produce. The cat-camel does not replace the targeted stabilizer retraining protocol for people with significant multifidus inhibition from back pain history. It is not a treatment for existing disc herniation requiring immediate medical assessment. It is a maintenance and prevention protocol for the specific mechanism by which daily sitting degrades spinal tissue, and its application is most effective when it is started before significant damage has accumulated. McGill's analogy in his clinical writing is precise. A wire bent repeatedly in the same direction eventually breaks at the bend. The cat-camel does not prevent all bending. It ensures that each bend is followed by a bend in the opposite direction, so the fatigue does not accumulate unidirectionally. The annular fibers of the disc, like any material undergoing repeated loading, accumulate damage faster when the loading is always in the same direction. The cat-camel puts the loading alternately in both directions and resets the distribution between sessions. The daily arithmetic of spinal health is not complicated once the mechanism is clear. 8 hours of sitting shifts the nucleus posteriorly and dehydrates the disc. 6 to 8 repetitions of the cat-camel, done twice across the working day and once in the morning, partially reverses both. Not perfectly, not completely, but enough to change the trajectory from progressive asymmetric annular loading toward a pattern where the posterior fibers receive relief before the next sitting session begins. That is what the exercise does. Every other back exercise of fitness industry addresses the muscles around the spine. The cat-camel addresses the spine itself, the hydraulic mechanism at its center, the joint surfaces that feed its proprioceptive signals, and the fluid that keeps its load distribution intact. 3 minutes, twice a day, before the first compression load of the morning, and after the worst sitting block of the afternoon. The mechanism is there. The evidence is there. What has been missing is the explanation of what is actually happening inside the disc while you do it. Thank you so much for watching until the end. If you loved this story, check out the other videos on your screen now. I think you'll really enjoy them. And don't forget to subscribe if you haven't already. See you in the next story.